Hello, my name is Kathy, and today I will be discussing how to use homeopathic remedies on ailments, continuing with special concerns of men, starting with the letter P, part 2. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and the emotions, then I'll move on to ailments of the brain and nervous system, then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and the metabolism, and after that I'll address the issues of homeopathic remedies on infections, infestation, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, postnatal problems, special problems of infants, ailments and diseases in childhood, special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-muir people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns of men, continuing with the letter P, part 2. This section covers those disorders that affect the male reproductive organs. Infections are the commonest kind of disorders, and affect the male reproductive system. For although the male urethra is relatively long and less prone to invasion than the female, it has direct communication with the testes, epididymis, and prostate. This means that kidney, bladder, or urethral infections can spread to the organs concerned with male reproduction. The testicles manufacture sperm and also produce the male sex hormone testosterone. They lie outside the body because sperm production requires slightly cooler conditions than those that occur inside the body. And the left testicle is usually lower than the right one. Normally, both testicles descend into the scrotum, which is the pouch of skin behind the penis, shortly before birth. At puberty, they enlarge and begin to produce sperm. Each testicle consists of an almond-shaped testes, where sperm are manufactured at the rate of 10 to 30 billion a month, and a much coiled tube called the epididymis, inside which the sperm mature for about 3 weeks. In all, it takes 60 to 72 days for a sperm to develop fully. From the epididymis, sperm move into the vasa deferentia and seminal vesicles for storage. In the seminal vesicles, a sugar-rich fluid is added to provide the sperm with energy. If mature sperm are not ejaculated, they disintegrate and are reabsorbed into the body. But if ejaculation occurs, the seminal vesicles and prostate glands contract powerfully, expelling about a half a teaspoon of semen into the urethra and out of the end of the penis and into the female reproductive tract. Sperm have a maximum life of 3 days. It is not possible to urinate and ejaculate at the same time because the reflexes that cause the bladder to empty automatically shut off entry of semen into the urethra. The prostate gland is a bulb-shaped and completely encircles the urethra at the point where it leaves the bladder. Its role is to add acids, trace elements, and enzymes to the seminal fluid at the moment of ejaculation. These activate the sperm and also give semen its distinct smell. For reasons that are not known, the prostate tends to enlarge and stiffen with age, narrowing the exit from the bladder. This obliges the bladder muscles to work harder to expel urine and can make urination slow and painful. The penis relies for its hydraulic power on 3 cylinders, 2 hollow and 1 spongy. These are arranged protectively around the urethra and only fill with blood during sexual arousal. Erection is maintained by strands of muscles at the base of the penis that slow the rate at which blood drains back into general circulation. The head of the penis is most sensitive to touch, and the shaft of the penis is most sensitive to pressure. Prostate problems. Enlarged prostate is extremely common in men over 45. Although the cause is not known, an enlarged prostate is symptomless until the tissue becomes sufficiently stiff and enlarged that it begins to interfere with the expulsion of urine from the bladder. At this point, the sufferer may find it difficult to start the stream of urine, especially in the mornings, despite urgent signals from the bladder, and may have to get up several times in the night. The stream of urine is also weak, and there may be blood in it. Some sufferers complain of a dragging sensation between the legs. The symptoms clear up of their own accord in 1 in 3 mild cases. However, if the condition persists and is not treated, possible complications include cystitis, bladder infection, and pyelonephritis, kidney infection, retention of urine, with the bladder expanding to hold more urine, while less and less urine is passed, and eventually kidney failure. A localized lump rather than general enlargement of the prostate suggests the possibility of cancer of the prostate. To rule out cancer, a biopsy is necessary. Specific remedies to be taken 4 times daily for up to 21 days. Difficult or painful urination with spasms of bladder and urethra. Use Sabal 6C. Where the person is senile, urinates frequently at night, complains of pressure on the rectum and smarting sensations at the neck of the bladder, use Ferrum Pic 6C. Frequent urge to urinate, slow stream of urine, person thin, underweight, prematurely impotent, use Baryta 6C. Frequent urgent desire to pass urine, use Thuja 6C. Loss of potency, shrunken testes, prostate feels hard, though hardness may not be due to cancer, use Iodum 6C. Impotence because erection is lost upon penetration, or lack of desire for sex, or pain upon intercourse, use Argentum Nit 6C. Self-help. Many sufferers find that lecithin and calcium and magnesium tablets help. The correct dosage are 2 or 3 tablespoons of lecithin per day and 1 calcium and magnesium tablet 3 times a day for 1 month. Evening primrose oil can also be beneficial. Prostatitis is an inflammation of the prostate, which is usually due to infections spreading from elsewhere in the urinary tract. An acute attack causes fever, pain, and tenderness around the base of the penis, and difficulty passing urine if left untreated. The prostate may fill with pus and burst, releasing pus into the urethra and causing further infection. This condition is most common in elderly men with enlarged prostates and tends to recur. A mild attack may clear up of its own accord. Conventionally treated with antibiotics in resistant cases, pus may need to be drained surgically. Homeopathic treatment is constitutional, but in an acute attack, the remedy that follows may help if there is no improvement within 24 hours. See your doctor. Specific remedies to be taken every 2 hours for up to 10 doses. Where the prostate is enlarged and the area around the prostate feels cold and where ejaculation is impossible or intercourse is painful, use Sabal 6C. Burning sensation at the neck of the bladder, frequent urge to pass urine, use Thuja 6C. Thick yellow discharge from the penis, urgent need to pass urine and lying on the back makes the matter worse, use Pulsatilla 6C. Self-help. If the condition is mild but recurrent, extra zinc and 2 daily 10 to 15 millimeter doses of cold-pressed linseed oil may be beneficial. I have a great many videos now on many different topics, and so I've decided to make several different video playlists. So check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.